Hello, everyone. My name is Ben Carrion, and today's webinar is going to be on the basics of pulmonary rehab. So, like I said, my name is Ben Carrion. I'm originally from a small little town called Franklin in the western North Carolina mountains. After graduating high school, I went to Lenoir University and I studied exercise science. After I graduated from LR, go Bears, I went to UNC and I got my doctorate in physical therapy. I'm currently living in Durham, and I work at WakeMed Raleigh, and I'm working in cardiopulmonary rehab, which is tons of fun. And I will be transitioning in July. I'm going to be the Duke cardiopulmonary resident, and that's a year-long program where you basically specialize as a physical therapist in cardiopulmonary rehab. Um, just a little bit about LR. Number one, always go Bears. Love LR, love Hickory. Such a foundation as far as what I'm doing today. Learning, just the basic principles of exercise prescription and the physiological adaptations to exercise. Learning that is a foundation of PT and then especially cardiopulmonary PT. And so, super thankful for what LR did. And I currently work with other physical therapists. I work with exercise physiologists, which is, I'm guessing, who I'm talking mainly to today. I work with respiratory therapists. I work with nurses. And so, it's a big interdisciplinary team. And I love working with everyone. I love everyone's background and how we can all contribute. So, thank you, LR. And once again, go Bears. Okay, so let's start off with, what is pulmonary rehab, number one? So this is a question that I'll often ask my patients that walk in the door. They'll walk in and they'll confirm who they are, and then I'll ask them, do you have any idea like what pulmonary rehab is? Did your physician tell you? Did you do any Googling? And it's a 50-50 shot, like sometimes they know exactly what they're getting into. Other times they have no idea. And so I'll just sort of give them a brief, overview of what it is. So pulmonary rehab is a program of education and exercise to increase awareness about your lungs and your disease. While you're here, you will learn to achieve exercise with less shortness of breath. So we have two different options here at WakeMed. There is a one-on-one option, and typically that's really good for our patients who are maybe a little more fragile. And then we also have a group option. So a group option is really great. It's pretty intense. It's 3 hours every day, but it's a chance for patients to meet others with their condition, and it provides an opportunity to give and receive peer support. So it's a really cool environment that we have there. I typically tell my patients the skills and knowledge learned in the program will help you feel better and manage your chronic lung disease. You'll become stronger by increasing your level of fitness. Exercising your lungs and your muscles helps you to be more active so you can do things you enjoy with your loved ones. And pulmonary rehab may even decrease the need for hospital visits, and that's always something that perks their ears up. So so that's sort of the spiel that I give my patients, and I just wanted to go through it with y'all just so you have an idea of what pulmonary rehab is. So who administers pulmonary rehab? The rehab team typically includes doctors, nurses, physical therapists, respiratory therapists, exercise physiologists, and dietitians. Basically, the team works together to create a personal program that meets the specific needs of the patients. And then I specifically work really closely with respiratory therapists, exercise physiologists, and dietitians, especially during our group therapy time when we have a lot of patients coming in. Everyone's basically working together to get the baseline vitals as soon as they come in, and then monitoring them as they do their exercise. And the group typically does a combination of ambulation, cycling, and strength training. Then they will transition to a group exercise class where they're, doing sitting exercises with either TheraBand dumbbells, weighted balls, all sorts of things. So this is a typical question that we get from our patients starting the program. Can I use my oxygen during pulmonary rehab? The answer is yes. Once you start pulmonary rehab, physical therapists will assess the patient, and they, at Wake Med, and I'm pretty sure this is everywhere, they will have them do a 6-minute walk test while, measuring the amount of oxygen in their blood, and it'll sort of show us how much oxygen is needed during different types of exercise, so that we're able to best guide them through the exercises and how to use their oxygen. So the 6-minute walk test, if you aren't familiar, is a measure of functional status or fitness. It is used as a simple measure of aerobic exercise capacity, and then it gives the physician a good idea of whether or not to do more sophisticated measures for the heart and lung function. But yeah, it's sort of exactly what it sounds like. It's 6 minutes as far as you can walk. And I typically always tell my patients, you want to wear something comfortable. And we have a big track in our facility. And so I tell them to stay in the outside lane. If they need to pass somebody, they can go in the inside lane, but then just come straight back to the outside lane. I won't talk to my patients while they're doing this test, just because that's a few less breaths they get to they miss out on while they're exercising. And so I won't talk to them. I'll just give them the time that they have left, and then I tell them not to talk while they're walking. And the cool thing is that we have a lot of data and a lot of research on the 6-minute walk test. So we take the results of the tests and then we compare them for what is known to be normal for people of the same height, weight, gender, and age. And so it's really helpful for us to see where our patients are functioning when compared to other people in the same category. So let's talk about who pulmonary rehab is for. Pulmonary rehab is recommended for patients with any type of lung disease who experience shortness of breath frequently, and these patients are typically not able to perform daily activities despite their daily use of medication. So many patients in our pulmonary rehab program have a diagnosis of COPD, but our program also helps people with other types of chronic lung disease that limits breathing and activity. So there's two sort of main categories. The first category is obstructive disorders. Obstructive disorders are characterized by a reduction in airflow. So these types of patients will have shortness of breath while they're exhaling air. And there's a thing called air trapping. So the air will remain inside the lung after full expiration. So a lot of these patients have a thing called barrel chest because they have a lot of air trapping within their lungs. And the different types of diseases that we would classify as an obstructive disorder is COPD. That's a big one. You probably have seen plenty of commercials on COPD, and COPD is actually an umbrella term. So there's 3 different diseases that go under that umbrella term. There's asthma, there's chronic bronchitis, and then there's emphysema. And so that all of those are under the obstructive disorders category. And then there's also bronchiectasis. Our other big category is restrictive disorders. So restrictive disorders are characterized by a reduction in lung volume. So our patients who come in with a restrictive disorder have difficulty in taking air inside their lungs. And this is typically due to stiffness inside the lung tissue, or it could be because of the chest wall cavity. Diagnoses under this disorder is interstitial lung disease. Obesity is actually under this disorder as well. It could be due to a neuromuscular cause. And then also one that you may not think of is scoliosis as well. People with scoliosis have difficulty taking air inside the lung, and it's because of that that stiffness of the chest wall cavity. So where is pulmonary rehab administered? Pulmonary rehab is typically an outpatient program, and it may be based in either a hospital or a clinic. You may also be able to receive certain forms of pulmonary rehab in your home, but what I tell a lot of my patients, because like some of them will ask this, like, can I just do this at home? Pulmonary rehab is so much more than just exercise. Exercise is extremely important, and it's a incredible intervention to tackle a lot of these pulmonary disorders. But it's also the education you get. We have PTs, RTs, dietitian. We have everyone will come and speak to our group class about how to manage certain things, whether it be a specific, we have a class on how to manage with your COPD. We have another class on, things that a patient with pulmonary dysfunction should eat. And so the education is a big part of it. But it's also the support for people like living with lung disease. You have that support there. You have that environment, and it's a good place to be. After our patients have been going to pulmonary rehab for a while, or depending on their level, if they're a little more advanced, we may be able to transition to some of the different exercises at home. We typically like to check with the physician before starting any sort of regular exercise routine. So let's talk about evaluation and outcome measures next. When a patient comes in, I'll essentially ask them a whole bunch of questions. I'll have a general idea from their previous encounters with their pulmonologist, because I'll get a lot of those notes. But I'll ask them what their social history is. Are they still smoking? How are they currently functioning? What their function looks like. Do they need an assistive device? Are they needing certain type of durable equipment in the bathroom? How's their shortness of breath? Are they able to do the things that they want to? I try to get a really complete picture of what life looks like for them right now. And then I also ask them what their prior level of function was. So, what was life like when you had less shortness of breath? And then, another great question is, what are your goals? What are your goals out of pulmonary rehab? So I'll ask a lot of questions to get a lot of background, just so I can get a complete picture of the patient. Objectively, we of course get their vitals. We listen to lung and heart sounds, and make sure that if I do hear something, then the pulmonologist either knows about it or I'm seeing it in a previous note. I will take a look at their gross strength and range of motion in all of their extremities. So I'll just do a general test for all of that. And then I'll look at their sensation. I'll look at their range of motion. And then we've already talked about the 6-minute walk test. I'll get that. I'll have them do a thing called an SPPB, which is the short physical performance battery. And it's sort of a combination of things. There's 3 different layers to it. There's balance, and there's gait speed, which is a very important thing to record and see. I actually, gave Dr. Lighting a paper on the, gait speed to give to y'all, and how it can be how it can be sort of like the 6th vital sign. So walking speed is something that I use regularly. And then the last part of the SPPB is a sit to stand test. So it's like a strength and endurance type test. We use a lot of different outcome measures in pulmonary rehab. So we use some of the ones that I've just said, and then we also use a depression scale, a shortness of breath scale, and a quality of life scale. We'll have people do that when they first come in, and then after when they discharge, we'll have them do the same thing and just sort of evaluate and see how things have changed while they've gone through pulmonary rehab. Thank you all so much for listening. I put my email on here if you have any questions at all. And if you're ever interested in working in this field as an exercise physiologist, just let me know. If you're ever in the Raleigh-Durham area, we could definitely set you up for a day of observation or volunteering. If you're interested in working in this field and moving out to this area, just also contact me. Let me know so I can pass your name up to my boss. Hope this was helpful, and good luck with your class.